Hello and welcome to today's webinar. It's part one of a series with CMS, WEDI, and CAQH CORE, CMS Complaint Management Reports. Thank you for joining us for today's webinar. And before we get started, I want to take a moment to go over a few administrative details. As you have noticed upon joining the webinar, everyone has been placed on mute for the presentation. At the end of the presentation, there will be a Q&A session. In your GoToMeeting control panel, you will see a questions box. Please type your questions or comments into the field and hit enter. The slide deck, along with the link to the recorded presentation, will be available for download. The slide deck is actually, you can go ahead and download it from the handouts portion of your GoToWebinar control panel, but the link will be emailed to all of you, all of our wonderful registrants following the live webinar. And feel free to share the link to the recorded webinar with all of your colleagues and anybody else who you think this webinar would be super useful for. Now, without any further ado, I'd like to introduce the WEDI Chair-elect, Ms. Nancy Spector, who's going to introduce our fantastic presenter for today.
Thank you, Sam. And I'd like to just welcome everybody to today's webinar again. Thank you all for an interest in this topic. And with that, I will go ahead and introduce Paul Anderson, who is a health insurance specialist with the Centers for Medicare and Medicaid Services Division of National Standards. And Paul has over 20 years of experience in the healthcare industry within various entities. And with that, I will turn it over to him. Thank you.
Thank you, Nancy. Hopefully everybody can hear me okay. I bring you greetings from CMS. We're very excited to be able to deliver this webinar to you today. So without further ado, let's go ahead and get started. So our topic today is going to be administrative simplification, enforcement, and complaint management. We have an agenda for today. We're going to do a slight introduction, administrative simplification basics, HIPAA enforcement, complaint management. We're going to cover the ASETT tool. We'll get to some Q&A, and then finally we'll leave you with resources and contacts. Next slide, please. So the Division of National Standards. So the Department of Health and Human Services has delegated CMS, or DNS as we'll call ourselves, to assist with the implementation and enforcement of compliance with HIPAA electronic transactions, code sets, unique identifiers, and operating rules. HHS handles HIPAA privacy, security, and enforcement. Our leadership is Madhu Anandata, who is our director, and Christine Gerhardt, who is our deputy director. Next slide, please. So a few basics. Most of you guys know this already. The HHS Office for Civil Rights handles privacy and security. HIPAA will cover transaction standards, code sets, unique identifiers, and operating rules for electronic transactions. The goal is to save time and money by streamlining communication around billing and insurance-related tasks. Next slide, please. So who's covered? Healthcare providers that transmit transactions electronically, health plans, and clearinghouses. Next slide, please. What's covered? Code sets, ICD-10, obviously, CPT, HCPCS, CDT, and NDC. Unique identifiers such as the NPI or provider identifier for providers, the employee identifier for employers, operating rules such as business rules or real-time response to inquiries, and transactions related to billing and insurance. Next slide, please. What's covered? So these will be all of the transactions. Obviously, most of you have seen these before: 270, 271, inquiry and response, eligibility, 276 and 277, claim status and request, 278 healthcare service reviews, 834 is benefit enrollment and maintenance, and some providers will use clearinghouses to make their transactions compliant. Next slide, please. So HIPAA enforcement. DNS enforces administrative simplification standards by responding to complaints about noncompliance and conducting proactive compliance reviews. Our goals are to reduce the burden on compliant entities or needing to, reduce the burden on compliant entities needing to conduct transactions with trading partners that aren't compliant. In addition, we seek to improve efficiency across the healthcare system by streamlining billing and insurance-related functions, allowing providers and health plans to spend less time on these tasks. Next slide, please. Complaint management, and next slide. So complaint-based enforcement. Anyone can file a complaint against a health plan, clearinghouse, or provider that doesn't comply with administrative simplification rules. Complaints can be filed online using the Administrative Simplification Enforcement and Testing Tool, also known as ASETT, which we'll get to in just a second. DNS keeps these identities of those filing complaints confidential upon request. So if you ever wish to file a complaint, as long as you select anonymous, we will keep who you are confidential. Next slide, please. So the ASETT tool. What we're going to do now is we're going to segue actually to the ASETT tool. So on slide 25, we have a link to the ASETT. If you can just click on that, please, and it will go to a live demo of the ASETT tool. All right, there we go. If we can click on the About ASETT. And let's take a look at a short video of CMS enforcement, and then we'll get into the tool. If you can click play, please.
CMS presents Enforcing Administrative Simplification Requirements. In the healthcare world, exchanging administrative information is not always easy. Different organizations and systems don't always seem to speak the same language. Now, imagine a world where healthcare transactions are all standardized, where data can be accessed more quickly, and potential costs are reduced due to automation. The goal of administrative simplification is to make that vision a reality. A set of specific requirements standardize electronic transactions in order to make billing and payment transactions between payers and providers both automated and seamless. Administrative simplification also serves to improve the patient experience by giving consumers a clearer understanding of their payments and financial liability. But in order for this to work, the requirements must be implemented consistently. That's where CMS comes in. To support implementation of administrative simplification, CMS enforces adopted standards. The CMS enforcement tool found on the cms.gov website can be used 3 different ways. First, if you believe a standard is not being followed, the CMS enforcement tool helps you to test transactions. You can test your own transactions or test the transactions of other entities that you deal with. Second, you can use the tool to file a complaint. And third, registered users can then track their complaint. By filing a complaint, you support the goals of consistent administrative simplification by ensuring the use of standards and uniformity in electronic information sharing. Once a complaint is received, a CMS representative will analyze the complaint to determine its validity. Our goal in resolving the complaint is to bring everyone into compliance. Solutions can range from an informal resolution, such as a corrective action plan, to a more formal resolution, such as imposing penalties. When compliance is reached, CMS closes the complaint. Enforcing compliance with administrative simplification standards will save time and allow us all to devote more resources to patient care. To find out more about administrative simplification, compliance, and enforcement, or how to file a complaint, please visit cms.gov and click on the Regulations and Guidance tab. Under HIPAA Administrative Simplification, choose the Enforcement link for general information, to test a transaction, and to file a complaint.
Thank you. If we can scroll down a little bit. And if you can click on filing a HIPAA complaint. So within the ASETT tool, you're going to find under the About page everything that related to filing a HIPAA complaint, testing a HIPAA transaction, or the actual process, which we'll talk about a little bit later. If you can scroll up to the top, please, and click on the home page. So again, here at the home page, you're going to see several different functions: the filing a HIPAA complaint and the testing of the HIPAA transaction. And if you can scroll down just a little bit. And you can see under filing a HIPAA complaint, if you just clicked on, let's say, a transaction, you'll begin to see a glossary. The glossary is going to have tons of information and breakdowns for that. If you can go back for me. And let's click on Get Started. So under the Get Started function, you'll see a step-by-step directions on how you can file your complaint. Scroll down, please. And if you just click on complaint type, again, once you'll see is a step-by-step as you complete these details. We won't actually go all the way to the end because it will require us to put in a number of pieces of information. But if you can just scroll down so we can see the complaint type. That's good right there. As you begin to file your complaint, you would just simply select one of the code types. And then once you get into the complainant information, it will ask for your information. And as you go further, it will get into what your complaint actually is, and then you will submit your complaint. If we can segue back to the PowerPoint now. All right, so back to compliance enforcement. So what if an organization isn't compliant? If an organization is not compliant, what will happen is once you file your complaint, we will gather all the information and we will work with that organization to resolve that issue. In some cases, it will require what we call a corrective action plan, or a CAP. That corrective action plan is used to address whatever issue is out of compliance. Next slide, please. So here's the complaint management process. As we receive new complaints, we call that part the complaint intake. From there, we will contact the non-compliant or the complainant parties. If you notice, it says FAE notice. That stands for filed against entity notice. So a letter is then mailed to that filed against entity, who then has 30 days to respond to the complaint. Once the FAE has responded, we will go through that initial response and subsequent response and mediation, in which case the CMS representative, or analyst rather, will analyze all of that information and determine whether that FAE is out of compliance. If that FAE is out of compliance, we will attempt to mediate that situation, or we may move to the CAP, as I referred to earlier, which is the corrective action plan. The corrective action plan could take anywhere from 30 to 45 days. It just simply depends on what the issue is and the length that it will take to fix that or repair said issue. Once that issue is repaired, CMS will monitor that issue or that CAP to ensure that it will stay in place and that the issue has been corrected. From there, we will move on to resolving that complaint and ultimately closing that complaint once both parties are satisfied. Next slide, please. So complaint statistics. These complaint statistics will be the typical complaints that we have received within CMS between the January and March 31st. This information is reported to us quarterly. So in the next week or two, we will have updated statistics, but this would be for the first quarter of the year. So as you look at this particular chart, you will see complaints received. 18% of the complaints we have received regarded code sets, and 82% of complaints received regarded transactions. Next slide, please. Complaints received by type. So open would mean that this complaint is open as of right now. that it could be in any status. As you can see, the number represents complaints in an active status. It could be outstanding issues remain, additional information is being sought from the complainant or the filed against entity. Close simply means that we have resolved the situation, and corrective action plan means that we are going through the particular steps to fix said problem. As you can see at the chart, during this particular time frame, we had 13 complaints that were open that regarded transactions, 3 complaints that regarded code sets, and we closed 1 complaint regarding transactions. Again, this is for the first quarter of the year. Next slide, please. So, complaints received by transaction type and who from. So as you can see, 100% of the 271 transactions that we received regarded health plans. Electronics or EFT and ERA, 33% were from vendors, 17% from clearinghouses, and 50% from health plans. 835 transactions, 100% of those were received from health plans. Next slide, please. Here is complaint closure, what we've completed in that particular time. So our tags here are resolved by mediation. Either the complaint parties resolved the issue, or we served as an intermediary to resolve the issue. Retracted, meaning the complainant withdrew the complaint. FAE deemed compliant, meaning the FAE was found or filed against entity again, was found to not have violated any HIPAA simplification rules. Or the corrective action plan was executed and the FAE completed all systematic updates. So as we look at the pie chart here, 39% of those were resolved through mediation, 31% was retracted, 15% were considered to be compliant, and 15% were considered to have executed the cap and completed what was necessary. Next complaint, please. Excuse me, next slide, please. So this concludes where we are now. We have some resources and some contact information. I'm certain that you guys have some questions. So if we can go to the next slide, please, which should be questions. All right, and this begins our Q&A session.
Hello, everyone. This is April Todd. I lead the CAQH CORE and Explorations programs, and wanted to save a bit of time on this call for questions. We know that compliance often raises a lot of questions from the industry. So please, we have a few questions that are coming in, but we would be very interested in other questions that individuals have. So as we start here, I'll start with one question. One question is, so on one of your slides, Paul, you showed where the complaints are coming from by transactions. There's a question asking, what's the most frequent transaction that gets complaints?
That's a great question. I would say the largest amount would be 270, 271 transactions.
Okay. And then a similar related question is, you showed that the complaints are coming from health plans and vendors, clearinghouses. Do you receive complaints from providers, and what types of complaints do you receive from providers?
We have received complaints from providers. I would say the majority of complaints that we received from providers were, again, eligibility issues.
Okay. Just a follow-up on that question, just a question for me. You mentioned that eligibility and benefits are kind of the most frequent transactions and maybe most frequent complaints. Is there any commonality around what the complaints are related to eligibility?
I wouldn't say that we've seen any trends at the moment. They're kind of all over the place. Again, we, and I haven't alluded to this earlier, there's a team of 6 of us. So we all have different type of transactions and different numbers or amounts of transactions. But I can tell you within our conversations, I haven't seen any trends as of the moment, but that is something that we're actively looking for.
Okay, great. I'm going to keep along this theme. We're getting a few different questions in here around this. There's another question in here around what types of complaints you have received around EFT and ERA.
That is a question that I would have to research for you. That's not something that I know off the top of my head. I mean, we have a large number of complaints. I cannot say that for myself that I've encountered anything with EFT, ERA, but that's something that I can research. If we have that contact information for that individual, I can definitely reach back out to them.
Okay. Yes, we have that. We can follow up on that one.
Okay.
Another question that has come in is, what are some more examples of ways in which the industry can use the ASETT tool? I know you went over a couple of them. Are there some more examples that you could share?
I would probably say the best ways. What's the way? How do I want to say this? The ASETT tool is most effective utilizing for testing transactions and filing complaints. I know that there are other ways that individuals may be looking for how to use the ASETT tool. I would say a couple ways. One, to use it as a knowledge base. It's definitely very helpful in breaking things down from a definition standpoint and understanding transactions as well. But I would say it is definitely most helpful if you're not filing complaint to utilize to test transactions. And by testing transactions, that will hopefully help you identify areas that either need to be repaired or fall under compliance. So I would probably say those are the best examples I can give at the moment.
Okay, great. So also related to the ASETT tool, we have a question. I'll just read the question here. Will a transaction that passes in ASETT also pass in the compliance review program findings?
That's a difficult question to answer. That's depending upon a number of variables. If someone were to have like a specific example, then particularly we could talk about that offline, but I would say that depends upon a number of variables.
Are there, can you give some examples of what those variables might be?
That's a great question. I would say, in what's the best way of saying this? It should pass through. It should pass. Those variables, it could differ. Again, that's not something I can answer at this moment. I'm searching for an answer to give to that one. That's something I couldn't answer at this moment. I would say, in theory, it should definitely pass, but I would say, again, it is dependent upon variables. So that's something we would have to look at on a case-by-case basis.
Okay. Okay. Let's see here. There's another question, a specific question here around Medicaid fee-for-service. It's a question of, is Medicaid fee-for-service or just Medicaid managed care considered a health plan in the definition under compliance?
Oh. Give me 1 second. I wasn't expecting that question. If we can park a lot that question, if you have that contact info, let me get back to them with a specific definition before I answer.
Okay, we'll do that. We'll do that. All right. Let's see. Another question in here. What is the status of the health plan compliance attestation mandate?
Let's also park a lot that one. I don't want to speak out of turn on that. I need to get clarification on that before I can answer that.
Okay. All right. Okay. There's a question here around the use of the ASETT website. The question is, can everyone use this site as an option to test HIPAA transactions? Are there any restrictions in using the site for anyone?
Give me 1 second. As of now, I don't know of any restrictions. As long as you're registered, it should be fine, but I don't know of any restrictions right now. So I would say anyone can use it.
Okay. All right. So we have a clarification question that has come in here related to the slide that you showed regarding complaints by transaction and entity type. The clarification question here is, are the complaints that come in, for example, on 835, are those complaints that are made by health plans or about health plans?
That's also a great question. I wouldn't be able to answer that until I went in to actively look at the complaints to make sure. In case I believe that there are a little bit of both, but that's something, if you want specifics, I can research that answer and get back to you.
Okay. All right, looking through some of the questions here. There's some technical questions in here. Paul, let me know if these are questions you can answer, or if this would be helpful to also send through on the list. It said, one question is, previously when using the ASETT tool, it had required a lot of personal information, such as a social security number. Is that still required, and if so, why?
Yes, it is required. In regards to the answer as to why it's required, let me find that answer out for you. I would rather get a specific answer for you rather than to answer it in this way. But yes, it is still required. But if you have that person's contact information, I'll respond back to them directly.
Okay. There's another question that has come in here around just advice that you would have for health plans responding to a complaint through the tool. How would you advise plans to file a response?
My advice for anyone wishing to file a response, depending upon whatever the complaint may be, would just be to simply go through the tool, file your complaint against, or just, file your complaint, and then allow the CMS analyst to follow up with you.
Okay. Here's a question that maybe we can jointly answer with you, Paul. I also have Taha Andrawala here, who leads our certification program related to operating rules. So we have a question coming in here on is the testing tool similar to those used in the core operating rule certification? So maybe I'll open it up first to you, Paul, and Taha can provide some answer to this as well.
Okay, I'm sorry, what was the question again?
The question is the ASETT tool similar to what is used in the core operating rule certification?
Oh, no, it's not. That's probably the best answer I can give. No, it's not similar in that fashion. At this point, we cannot test operating rules within ASETT.
And this is Taha, Senior Manager at CORE, and just to expand on that with the CORE certification kind of tool that we have for testing conformance to the rules. It can test both for conformance to the transactions for the ones that mentioned here, and also testing conformance to the operating rules and prospective. So you have both that level of checks and balances for the transactions and operating rules as well.
Okay. So we have another question coming in related to testing a file in ASETT. The question is whether it is okay to test a file in ASETT that includes PHI, protected health information.
Yes. Yes, you can.
Okay, great. Another question also related to the complaint process. If an entity was found to be non-compliant but completed a corrective action plan, would they still be fined?
If it ever graduated to that response, typically what would happen is once the corrective action plan is completed, the situation is resolved at that point. Getting to the point of a fine is pretty, I would say, it's definitely more of an elevated response. But typically, once you complete the CAP, that would be the end of the situation.
Okay. There's another question here related to a corrective action plan. The question is, what happens if a health plan has not sent in a corrective action plan and it has been over a year? What type and level of penalties would be given?
That particular question is more of a specific question, and again, that is dependent upon a number of different variables. If the situation is as the question was sent in, that situation would be elevated to CMS leadership to handle from that aspect. A year is a lengthy amount of time to either have not have sent in a plan. So depending upon the different variables or what have you, we do know that sometimes CAPs can take a very long time depending upon the severity of the fix. However, that particular situation, I could not answer specifically. However, I can tell you that it would be elevated to CMS leadership and taken higher from that standpoint.
Okay. All right. There's another question that has come in also related to the types of complaints that you all get. The question is related to how many consumers or patients actually file a complaint, and if they do, do you have a sense of what the volume of that looks like, or what type of complaints are filed?
Obviously, we have had complaints from patients. Excuse me. Again, let's take that individual's contact information and I can respond directly. I would rather give you something a little bit more accurate than a ballpark in that particular question.
Okay, that would be great. Another question that we have, this is around the complaint process as well, and again, this is in the advice category, so we'll see what you have here in terms of advice. This entity is wondering whether CMS would recommend that entities try to notify and work with their trading partners prior to filing a complaint, or whether you would like to see the complaint before significant efforts go into work to resolve an issue.
Typically, we would love for you to attempt to resolve the issue amongst yourselves and not get to the complaint process. As far as advice goes, I would definitely tell you to work with your trading partners to resolve issues. However, if the issue cannot be resolved amicably between the two parties, then that is where the complaint process would come in, and then CMS would attempt to rectify that situation or mediate that situation together.
Okay. All right. So Paul, we have quite a few questions coming in here around maybe specific kinds of transactions. So you'll have to tell me here if these are ones that you want us to put on the list as well. And actually, maybe one of the things, the ones that are on the list, particularly the ones that are asking about just volume of complaints and types of complaints, if that is something that would be okay with CMS, maybe that's something that we could get some statistics and kind of put up on a common page where participants from this call can kind of see what the results are. Would that be something that you guys would be amenable to?
Sure. Let's take a look at what those responses are. We can go from there.
Okay, great. So this question is, do you receive complaints from entities that are complaining that a trading partner refuses to implement certain transactions? And the example that's in here is, do you receive a lot of complaints from providers complaining about health plans refusing to transact the 278 for prior authorization?
Yes, we do receive those. Were they looking for a particular volume, or just do we receive them at that?
I mean, I think they would be interested in the volume of those. I think that a lot of the questions that are coming through, I think people are very interested in seeing, one, both the types of transaction complaints you get in the volume, who is making the complaint, whether it's a consumer, a provider, a plan, and against whom as the entity, not being compliant. It seems to be very much of interest for people in the questions that they have.
That's awesome. This is definitely the type of feedback that we are looking for. We have another question here about, and this is related to the 270, the 271 around eligibility. And they're curious what types of complaints that you get regarding use of web portals. Is there anything you can share there around the types of, if you get these complaints about web portals, and kind of what the complaints tend to look like? That would definitely be something that we have to research. I mean, that's definitely a specific question. If you can park a lot that one as well, I can research that for you. I wouldn't know that off the top of my head.
Okay. Okay. So another question here around compliance. And you may have said this, but if you could repeat this, I think this would be helpful for the group. Folks are asking, once a complaint is filed, how long does the entity for which it was filed against have to respond? And what is the process? How does the process work once an entity responds to a complaint?
It's a great question. Typically, the FAE has 30 days to respond once we send them the initial letter. Post that, there's a number of different variables that could come into play. Again, Once we receive a response back from the FAE, we will then begin the investigation process. The investigation process can take anywhere from 30 to potentially 45 days, depending upon how much information we need to gather to initially make a decision. Once a decision is then rendered, if it requires a cap, if we have found that FAE to be non-compliant, the cap process can depend upon, it can take the time frame, it depends upon the severity of the fix necessary or needed. And that could range from a number of, I would say, anywhere from 0 to potentially 6 months, depending upon what fix is necessary.
Okay, great, thank you.
Mm-hmm.
Another question here around, I'm going to read this one. Can you tell us how many health plans or clearinghouses have been audited through their compliance review process that started in April? And if not, do you know when those numbers or statistics would be available?
9 at this point.
9, okay.
Yes.
Okay. Another question coming in around the penalties. There is a question around whether CMS can provide information on penalties that have been levied on violators and the type of entity and the type of penalty. Are those type of statistics available?
Not at this time.
Okay. This is a similar question. Does CMS have any plans to de-identify complaints requiring corrective action and summarize and publish the de-identified issue and resolution? And the comment here is this would be very helpful to promote awareness and encourage entities to research within their own organization to verify compliance.
Presently, we do not have a plan to do that. We are looking into that, so that's definitely helpful feedback. But currently, we do not have a plan to do that at this time.
Okay. Okay, here's another one. If an entity wanted to use the ASETT tool to test their own transactions and a lot of errors were identified, would that entity be at risk for CMS to be notified and possibly audited?
No, I would say no to that question.
We have another question actually coming in around operating rules. And I actually think this may be a better question for Taha and myself, so we can probably answer that. But Paul, please add on if there's anything additional you'd like to answer there. We have some questions coming in around the Phase 4 and Phase 5 operating rules. There's a question of when federal rulemaking would be finalized and those phases of rules mandated, and what the compliance date would be. So maybe I can start with an answer here, and Paul, if you want to add anything on, that would be great. So the Phase 4 operating rules are are voluntary, and the Phase 5 rules have just been completed, and we are working on the certification tool set for Phase 5. For those two rule sets, there is the intention that we will bring them back to NCVHS later this year for consideration by NCVHS. If NCVHS were to recommend those to HHS for mandates, that would be a rule set that HHS could consider to put through the rulemaking process. And then maybe I can open it up here to Paul about once that recommendation would go to HHS, what that process looks like for it to go into rulemaking.
Oh, were you throwing that back to me? I'm sorry.
Yes, back to you.
Okay. So once that recommendation is made to HHS, then HHS will direct it to CMS and further down to DNS, and then we'll begin the process of that. Again, there are lots of steps in between and so forth, but that is the general response that will happen.
Okay. And then there's another question here about once how long the process takes. So once the National Committee for Vital and Health Statistics, once they would make a recommendation and it goes to HHS, how long does that process for getting a rule, a proposed rule out, how long does that take?
I don't believe there's really no generic or typical response to that. Excuse me, it can be a fairly lengthy process. I would say anywhere from 6 months to potentially 2 years, but it all depends. Again, there are many different steps that happen in between, many different obstacles or impediments that could happen, but I would say ballpark anywhere from 0 to 2 years.
Okay. There's another question here of, does CMS plan on building a portal platform to submit service requests, or is the secure encrypted email the permanent method?
I do not know whether we plan on building a portal for that, so I would say the encrypted method will be the method going forward, but that could potentially change, but I don't have any knowledge about a portal being built.
And then maybe a general question for you, Paul, related to given we've gotten a lot of questions about the ASETT tool, and are there any future things planned with the ASETT tool? Maybe just a more general question for you is related to the ASETT tool. Are there any plans that you guys have for the near or longer term future to modify, enhance, or build on the ASETT tool? And if there's anything you can share related to that.
I don't have any updates to the tool as of right now. Again, we always take a look at the tool and evaluate the tool for further updates. But as of right now, we don't have any plans to change anything as of this moment, but that could change at any time. Okay.
And then maybe a follow-up to that question. Just given some of the questions that we've gotten from organizations on this call, is there a way for industry participants to share with CMS some things that would be helpful to modify, add, change to the ASETT tool?
Sure. I'm trying to think of which contact information we would use for that. Let me get back to you on that. We have definite email addresses that we can use, or inboxes rather, for sharing that information. But I want to make sure that we have a specific one. I don't want to put out the HIPAA complaint email address because that's not what it's used for. But per our next webinar, we'll have a inbox, or at least a way for that information to come to us directly.
Great, great. So we have another question that is coming in here that is related to core operating roles. So Taha and I can take this one, but if there's anything, Paul, that you would like to add on, please do that as well. The question has come in around whether all the operating rules are mandatory and whether core certification is voluntary or mandatory. So can use this time to clarify that a bit. So for operating rules for core, there are currently 5 phases. The first 3 phases, phases 1, 2, and 3, related to eligibility and benefit, claim status, EFT and ERA, those operating rules are all mandatory for the industry. It is required that the industry comply with those operating rules under HIPAA and ACA Section 1104. The phases 4 and 5 are currently voluntary, but we do have plans to bring those forward for consideration for mandate later this year. In terms of certification, core certification is voluntary. We offer that to the industry for the industry to be able to validate and ensure that they are compliant with the operating rules, and also to be able to demonstrate to their trading partners that they are compliant with the operating rules. Actually, many of our participating organizations require that their trading partners have a core certification to be able to contract and work with them, because they want to ensure compliance with the operating rules, but the certification itself is voluntary. So I don't know, Paul, if there would be anything additional you'd want to add related to operating rules.
I think you covered it all. You covered it probably better than I could.
Great. All right. Let's see here. All right. One last question would be, are there any future plans for education from CMS or from WEDI and CORE related to compliance around transactions, standards, and operating rules? Paul, do you maybe want to take that first?
I'll take that first. As far as outreach and education in regards to those topics, there's always information on cms.gov under regulations and guidance, where you can find a lot of that information. We do plan to have the webinars. Obviously, we're having one now, and then we'll have another one on the 18th of July. So we're always looking to push out new information. I just wanted to circle back to one question that you had before in regards to sending us information to better the functionality of the ASETT tool. If we can put out an email address, and that would be Administrative Simplification at cms.hhs.gov, you can utilize that inbox to send that information to.
Great, great. And then what I would add on, and if Nancy is able to get on and answer this as well for WEDI related to compliance, for CORE and for WEDI, we are holding a joint webinar again on July 18th. It's a follow-up webinar with some additional topics that folks can join on. And also from CORE's perspective, we routinely offer webinars that we make available on our website that provide information related to compliance, as well as CORE certification that help individuals verify that they're complying with the rules. So you can go to our website and both find the webinars, future webinars that are coming, as well as past ones that have existed on both of these topics. All right. All All right. I think we have at this point exhausted the questions that we have gotten through. If I have happened to miss some, given we had a lot of them coming in here, I hope I didn't miss one. But we will look through them again and make sure to follow up both on those questions and on the questions that Paul had mentioned that he would follow up on. We will follow up on those questions and look to get information out to the organizations that participated in this call, and just want to really thank you for joining us. We can definitely tell from the number of people on the call as well as the questions that were coming in that this is definitely a topic of interest for organizations. And so again, want to thank you for being on, and also refer you to the additional webinar that we have on July 18th, and I would hope that you join that webinar as well. So thank you, and we will see you, hopefully many of you, on the 18th. Goodbye.
All right, thank you.